Good morning. Happy Friday, everyone. Welcome to another episode of the PT on Ice Daily Show. My name is Jason London. I'm a physical therapist and lead faculty with the Institute for Clinical Excellence for the courses of Rehabilitation of the Injured Runner, Rehabilitation of the Injured Cyclist, or Professional Bike Fitting. And coming soon in 2021, we'll be also providing a Rehabilitation of the Injured Runner online. And a very good morning to all the ICE faculty that are en route or already in Nashville for a great weekend of learning and camaraderie. I wish I was with you, and I hope you have a great weekend. So what I wanted to talk about today was definitely within the vein of the endurance athlete, but more of a winter sport. We're in the heart of winter, and hopefully we'll get into more of the heart of winter here soon up in Bozeman, Montana. It's been a pretty poor start to the ski season. But one sport that's really been gaining in popularity in our area and across the West is Skimo. What is Skimo? Skimo is ski mountaineering. It's a race series, so it's actually somewhat similar to trail running, and a lot of trail runners, especially ultra runners, have been getting into the sport lately, and it involves navigating a course. Typically it's going to be at a ski resort where you're traveling up by skinning up on their skis on cat tracks, and then some climbing by boot packing, and then some descending. So most races last anywhere between 1 to 3 hours and involve a minimum of 1,500 elevation gain. And it's also was featured recently, or was supposed to be featured in the 2020 Youth Olympics. It may be becoming an Olympic sport as well. So really gaining in popularity. And, you know, with that, for kind of more, I guess, more of the mountain athlete population that you might be seeing is backcountry skiing and snowboarding too. So we're going to kind of group all of those injuries together. And how to manage those injuries. So backcountry skiing and snowboarding, again, someone is going to be touring up, so basically like cross-country skiing up the mountain, and then taking their climbing skins off and then descending a run. So the descending part is exactly like skiing or snowboarding at a resort. And unfortunately, there are injuries that occur with that, and you will see patients in your clinic with that. And not just if you live in the Mountain West or in the West, you'll also see those patients in the Midwest or in the South, because it's really been increasing in popularity, and we are seeing a lot of people who are now vacationing, whether it be out here in Montana or in other areas where their vacation is doing backcountry skiing. So important things to apply for if you have that patient recovering from an injury who mentions that they're going on a backcountry ski trip, and they happen to live in Louisiana. So you'll just be ready for that. So we can really divide these injuries, mechanisms of injuries, into three categories. So we have our uphill injuries, which are typical overuse injuries. We have our downhill injuries, which are our typical ski and snowboard injuries, are mainly traumatic. And then we have our tragic injuries, which are related to the environment and avalanches. So with uphill injuries, the primary complaint typically with that is going to be lower back or hip pain, anterior hip pain. And this is really due to a lack of core strength, particularly in the spinal extensors, and poor technique. So for technique, you really want to counsel your patients or yourself if you happen to be a backcountry ski enthusiast or Skimo racer, to keep an upright trunk while you're skinning up and trying to stay off the risers. So risers are little levers that you can flip that raise the angle that your heel is at and coming down to, and make it a little bit easier for climbing steeper terrain. But that puts the hip in a bit of an awkward position, and can really increase compressive forces at the anterior hip, leading to either irritation of the hip flexor muscles or the joint itself through more of an impingement scenario. And so trying to stay upright where you're not leaning forward and getting in that hip flexed position is a great way to prevent that, as well as just doing a lot of strengthening, particularly the spinal extensors to keep you upright, and doing things like weighted step-ups to really strengthen the glutes, which will also help keep you upright. And then treatment of these injuries or overuse injuries really follow how you would treat, a runner with anterior hip pain, or a runner or a cyclist with low back pain. On the way down is when we have our traumatic injuries. So these are exactly the same injury patterns and prevalence that you're going to see with people who are skiing and snowboarding at the resort, where unfortunately knee injuries are really high, have really high incidence. And of those knee injuries, the ACL injuries are occurring at a really high rate in skiing and in expert level snowboarders. And for snowboarders, it's the lead leg that's affected. And in skiers, interestingly, there's a study that came out showing that it's mainly the left leg, or the left leg is more often injured. So for prevention of those injuries, because an ACL injury can certainly be season ending, regardless if you get it reconstructed or go the non-operative route with just getting really strong and working on dynamic stability. And a lot of those patients can definitely get back to doing everything they want to do without an ACL. Unfortunately, that doesn't happen very often in the US, just because of I guess our tendency to want to get things fixed and get the easy way out, so to speak. But I definitely have managed athletes who've successfully gotten back to high level sports without ACL. But to prevent those injuries, we really want to make sure our patients are strong and really working on both quadriceps strength for knee stability, as well as hip strength and control for where that knee is going to be positioned. And to figure out, again, if there's going to be a side-to-side discrepancy, because, again, for alpine skiing, the left knee seems to be injured more frequently. And then in snowboarding, the front leg seems to be injured more frequently, which typically is going to be the left leg for most snowboarders. So for doing that, you do want to do some sport testing, hop testing, looking at limb symmetry indices, and then addressing those discrepancies that you're seeing through doing some single leg work in terms of strengthening. But ultimately getting into doing full depth either back or front squats, doing deadlifts, and then working on some single leg balance and control. Another common injury in skiing and in backcountry skiing and snowboarding and Skimo, as well as cross-country skiing, is an injury to the hand, to the thumb, to the ulnar collateral ligament on the thumb, which is oftenly called, the injury is called skier's thumb. So it's either a strain or a tear to the ulnar collateral ligament. And the reason that's occurring is the athlete is falling with their pole in their hand, which then is leveraging and putting a hyperextension and valgus force on the thumb, tearing the ulnar collateral ligament. This can be either treated conservatively or with surgery, just depends on the presentation. If the ligament gets displaced, this happens to be what's called a Steiner lesion, that a lot of times is going to be fixed surgically. Most other presentations are going to be treated conservatively with splint for 4 to 6 weeks, and then working on range of motion and return of pinch strength. If it's surgery, they're going to be in a splint or a cast following the surgery for 4 to 6 weeks, and then the rehab is the same. But it's important to pick these injuries up, particularly if you have someone who's coming in the clinic and maybe complaining of some other trauma, but asking them if they sustain any injury to their hand, because when they are falling, they're definitely going to fall with an outstretched hand. And typically, for everyone on the way up, they'll be having their ski poles in their hand. And for skiers and Skimo on the way down, they'll be having their poles in their hand too. Snowboarders will be having their poles on their backpack. But a good way to prevent these injuries is to one, make sure that they know how to put their ski straps on properly. So if you're coming in from the top and coming down and you drop your pole, as you're falling, that pole stays right within your hand, which then it creates that lever to disrupt the ulnar collateral ligament. However, if you come in from underneath, put your pole straps on, and you're falling, you drop your pole, it comes out from your hand, so it's less likely to cause that injury. Better yet, though, is really just not skiing with your ski straps, particularly in backcountry skiing, because your poles, if you are caught in an avalanche, can definitely can be an anchor and pull you down, and also make you more difficult to get out of an avalanche, which is a great segue, of course, into our tragic injuries and situations that occur in backcountry skiing, snowboarding, and Skimo. And that is avalanche hazard, which is kind of our environmental hazard. And there, you can really mitigate your risk for being caught in an avalanche with backcountry skiing by careful terrain selection and assessing the snowpack. But unfortunately, it really doesn't seem to be happening all that often for people, particularly this year. Recently, I just saw that for Colorado, just in the past week, there were 74 human-triggered avalanches. That is astounding. Backcountry skiing and snowboarding and Skimo are growing at a astronomical rate in popularity. Equipment has gotten a lot better, and now, with the current pandemic, some ski areas have been shut down, so people are really wanting to get out and ski and snowboard, and are getting in the backcountry for that. But you need to have some education, because really the risk for avalanches can really be drastically mitigated through just proper planning and techniques. So for that, make sure that you're checking your daily avalanche report, and kind of following the trends on what's happening in the snowpack. Definitely getting trained, taking an avalanche rescue course, and then just within the group dynamic of when you're backcountry skiing, really making sure that everyone feels comfortable voicing their opinion and any of their concerns. And again, careful terrain selection. So you can definitely choose terrain that's a little bit more mellow, that really doesn't have the risk of avalanching, because the slope is so low that just the avalanche can't get going. And you can have a great day skiing or snowboarding powder with that. But if the snowpack is right, you can certainly get into steeper terrain as well. So again, want to make this for the patients that you're treating, but also for yourselves. If you happen to be into backcountry skiing, snowboarding, or getting into Skimo, I think we're going to see a huge rise in popularity, continued huge rise in popularity with Skimo racing. So you will be seeing those athletes coming through the clinic. And just as with treating our runners and cyclists, a great patient population to work with. That's all I got for today. So have a great weekend. Get out there, have fun, stay safe. And as far as upcoming courses, there's a lot of ICE online courses that are coming online right after the new year. And I would highly recommend any of the ICE online courses. I took my first one, actually, my first online course ever, and it happened to be the fitness athlete course this past spring. And I was blown away by how interactive it was and how much I got out of that course. I actually got more out of the online course than the live course. I think just having the time to sit and process the information, study the information each week really helped to come out with probably retaining and utilizing a lot more of the information than I did out of the live course. The live course, of course, is a lot of fun and a great course in itself, but I was totally blown away on the online course. So also Rob Vining's telehealth course was really helpful. And then I know Modern Management of the Older Adult has an online course as well. And then Sarah has her private PT practice course too. And Megan and I are working hard to get an offering of the rehabilitation of the injured runner as an online offering as well. So look for that in 2021. Everyone have a great end of 2020. Stay safe and have fun treating patients. See ya. Stop.
Hey, thanks for tuning in to the PT on Ice Daily Show. If you enjoyed this content, head on over to iTunes and leave us a review. And be sure to check us out on Facebook and Instagram at the Institute of Clinical Excellence. If you're interested in getting plugged into more ICE content on a weekly basis while earning CEUs from home, check out our virtual ICE online mentorship program at ptonice.com. While you're there, sign up for our Hump Day Hustling newsletter for a free email every Wednesday morning with our top 5 research articles and social media posts that we think are worth reading. Head over to ptonice.com and scroll to the bottom of the page to sign up.